drivers coast to coast, border to border. Nice to have you on board. Yeah, we're in Canada and all across the United States. So let me get you in. You know, the important thing is to hear from you about things that are going on in your life. And we're going to talk about some medical issues that are going on in your life. And May, you probably know, is Mental Health Awareness Month. And this is a big time, a big month to go into a lot of details about this. Mental health issues are a problematic situation, as many people are coping with so many different things out there. And what does things like, say, if you've got some mental health issues, what can it do to, like, your heart? If you're feeling angry, if you are maybe seeing red, if there's some issues going on, can it increase your chances of heart disease? Dr. Fahmi Farah is on with us, one of North America's leading cardiologists. And Dr. Farah, it's great to have you back on the radio. And as we always do, a little bio about you. Welcome back.
It's great to be back, as always, on your show. I am an invasive cardiologist, CEO and founder of Bentley Heart Medical Center, and director of Global Health Lines Foundation.
Okay, very good. Thank you very much. And May, of course, is Mental Health Awareness Month. And what are your thoughts on this as far as a correlation, say, that if someone is having, say, some mental health concerns, say, anxiety or pressure or tension, can this lead to maybe an increase in maybe some heart-related issues? Can there be a correlation here?
Yes, there can definitely be a correlation between mental health issue and heart disease, especially things like depression and anxiety. Those that have well-known correlation with coronary artery disease because, you know, with anxiety comes unhealthy stress hormones that our body releases. And with that, of course, we can have elevated high blood pressure, heart rate can be elevated, and it just increases overall, you know, the risk for cardiovascular disease. Depression is a major risk factor, actually, for cardiovascular disease for a number of reasons. It just also increases your unhealthy behaviors. So for a number of factors there.
I was reading some information from the American Heart Association, Dr. Farah, that feeling angry for as little as 8 minutes a day could raise your chances of experiencing a cardiac event. If you're angry 8 minutes a day, it could raise your chances of experiencing a cardiac event. My golly, that's just an amazing fact right there. Talk about anger, the anger issues with that.
Yes, it's a big issue, and, you know, of course, we are all subjected to this. So, yes, when we're angry, our body goes through a couple of physiological changes, and sometimes it's abrupt change. So we go from a state of calm to being angry, and our body secretes a lot of stress hormones that are very damaging, actually, that can suddenly cause your blood pressure to go up. It can go up very high. Same thing with heart rate, and it causes a lot of strain and stress on the heart. People who have pre-existing heart disease, and even those who do not have pre-existing heart disease but are at risk, they can actually have a heart attack. So that's why, like, sudden anger is not a good thing. Also, with that elevated blood pressure that takes place, people can have a stroke as well. So anger is a risk factor for both of those.
Okay, absolutely. And explain for those who may not know, what is a stroke? We've heard the term quite a bit. What exactly does that do to the body?
Stroke is a phenomenon that takes place in your brain. It's similar to a heart attack, except it's happening in the brain, where the blood supply to the brain in a certain area of the brain gets cut off abruptly. And as a result, that tissue in the brain can die. So that is a stroke.
Okay, and when you look at some of the immediate factors that maybe someone has some mental health issues or concern, if they go into like an anger mode, that is going to trigger some issues with the heart. What if you are recalling memories that triggered anxiety? Say there was some kind of a traumatic event somewhere back when. Can thinking about that, recalling memories, can that trigger anxiety and then possible heart conditions or problems? Can that go hand in hand?
It can. There's something called post-traumatic stress disorder, also known as PTSD, for those who have gone through, any kind of traumatic event in their past, and they can recall those, and those are called flashbacks, and they can really experience that whole traumatic event all over again in their mind, and the effect on their body can be very similar to the first time, where again, a very rapid heartbeat can happen, and that can cause symptoms of chest pain, shortness of breath. They can even go into panic attack, and panic attacks can feel very similar to a heart attack. So it could be the discomfort can be quite high, and what effect it can have on the heart in itself is similar to the anger and stress and anxiety. It can cause somebody's blood pressure to go up, and that acute onset can have impact on the heart.
My goodness. What about sadness? Say the other side of the coin of that, say that somebody was undergoing some concerns, sad events, something maybe happened, somebody passing away or whatever the case may be, and simply trying to recount that or think about that, is there a correlation there? It's amazing what the brain can do. Is there a correlation between, say, recalling a sad event and triggering some heart issues for that person?
Unfortunately, yes. There can be both a direct effect on the heart and an indirect effect. And what I mean by that, directly, there's something called broken heart syndrome. It's something we see in people who have experienced some kind of a loss or trauma. Usually has to do with a loss of a loved one, either somebody's husband or spouse have died, or somebody who's going through a very bad breakup in a relationship, and that kind of trauma can take a toll on the heart and can cause something called broken heart syndrome. It's a very well-known phenomenon in the heart where the pump of the heart kind of gives out from the stress of the situation, and it's a type of heart failure, actually, where the heart pump just doesn't function as appropriately and as optimally. And the other name for this is called Takotsubo cardiomyopathy. So that's a direct effect of, something like that. And then the indirect effect of that kind of sadness is that, when we're depressed, when we're sad, we're just not wanting to do the healthy things that we're used to doing. For example, we're not going to have the drive to go walk, so our exercise activity level can go down. That's a risk factor for heart disease. So, similarly, our drive to eat healthy will go down. So, unhealthy eating is a direct correlation to coronary artery disease. Also, people tend to engage in unhealthy behaviors by smoking more or picking up smoking, drinking more, so alcoholism becomes an issue. So there's a number of things that play a role in this.
Okay, and when you're mentioning all this, Doctor, I'm thinking that, if somebody is angry, you mentioned adrenaline, and is this a situation where the body creates adrenaline response known as, what is it, I think it's called fight or flight? Is that good for the heart, fight or flight?
It has good and bad, and the situation matters. So, yes, you're right. It is the fight or flight response. It is adrenaline that gets secreted in the body. And when that happens frequently in a stressful situation, it can have a detrimental impact on your heart. And it's not just the adrenaline. There's also other stress hormones like cortisol and things like that that are not so good for your heart.
Doctor, let's do this. My golly, what a fascinating subject. We got a break for commercials, and we got to do all of that. Drivers, get in. Love to get you on board. What kind of a person are you? Are you anxious, nervous? Are you maybe agitated? Maybe just kind of one of those bad days like everybody gets, and you're just agitated at the world. You're thinking about all the stuff going on. Think about what that's doing to your heart. There is a correlation there. Dr. Fahmi Farah is on board with us, one of North America's most recognizable names when it comes to cardiology. And we're going to break back in a minute. Stay tuned. Drivers, the human body is a fascinating creation. When you think about everything the body does, how it can heal itself, the body will talk to you in the forms of aches and pains. Your body's saying something. You got to get your butt in. Get checked by a doctor. If there's something going on with your heart, that's why you got to get in and see Dr. Fahmi Farah, one of North America's leading cardiologist. And Dr. Farah, thank you very much for joining me on the program. Let's go first up to Bill on the line with us in New Mexico. Bill, welcome. You are on with Dr. Fahmi Farah.
Hey, guys. Hey, Doc. How you doing?
Hey, doing well. How are you doing today?
Good. I have a couple of questions. Back in 2013, I had a motorcycle accident, and I had like a minor concussion, the doctor called it. And since then, I've been like having episodes like really angry, and I'm not sure what to call it, but like I used to have a filter, and now I pretty much just tell people whatever I'm thinking. And then in 2021, my liver got a clot and a vein in my throat ruptured. That was pretty traumatic. So I'm wondering if that could be PTSD.
It could be, yes. If you're, experiencing the same trauma from before and it's affecting your mood and, the anger spells that you just described, it could certainly be related. So my recommendation is definitely to talk to your doctor and dive more into it and see what help they can provide.
Yeah, then my other question is, so my insurance found me a therapist, and we were working together. And then one day I mentioned that I was in a different state, and she told me that she wouldn't be able to treat me anymore because I wasn't, I guess, in the state, or I wasn't in the city where I lived at.
You were traveling, or did you change residence?
No, I'm a truck driver, so I'm, I'm all over the place. Yeah,
I was just wondering if your local residence changed. That's what I was kind of wondering about. But you're on the road, obviously, quite a bit. Doctor, how does that work based on what Bill is mentioning? Insurance criteria, could that have changed? Maybe that's one of the reasons why maybe she couldn't see him anymore. What are your thoughts on that, just overall?
In my clinic, I will tell you that insurances do cover for telemedicine. And for telemedicine, they don't require you to be in any one particular place. That's the beauty of telemedicine, is that access to care is a lot more enhanced and available. So I see patients, even when they're out of town, they can still log in and come in with telemedicine. So majority of the insurances, they do cover for telehealth, telemedicine, and majority of the providers, they do provide telemedicine. So if that one provider, maybe they don't provide telemedicine, but you can shop around and you can ask your doctors if they provide telemedicine, then that would solve that problem.
Okay, I guess I should start maybe with the insurance company or find a provider that does telemedicine.
Yeah, absolutely. Bill, thank you for that phone call. I appreciate it. And that's one of the beauties, Doctor, like you're mentioning about telemedicine, that say that a heart patient that is under your care, under your direction, say he or she is out of town. Maybe they're in some city or someplace else, but they're not with you there in the same city. The patient can still reach out to you wherever they may be, and you can do a telemedicine call with them, right? That's the beauty of this.
That is correct, yes. And that's the whole reason why we all love telemedicine so much, because it doesn't prevent a patient from being able to get the care that they need when they need it, even if that means they're out of town.
Yeah, I think one of the most important things is for people to be proactive, correct in that? And you mentioned this on the show before from the standpoint that the people that are listening, they are their best advocates out there because no one else is going to do this for them. That lifestyle of being a professional truck driver, it's a very lonely, isolated job. And many are thousands of miles from home at any point of the calendar year. So if a driver, like I was mentioning earlier, is experiencing aches or pains, that's their body trying to tell them something, correct? They want, the body
Correct.
says, go to the doctor. What do you think?
Correct. Yeah, I completely agree. When your body is telling you something with pain, you should listen to that. It just means that you should get that checked out.
All right, very good. Doctor, any closing thoughts for the drivers out there? I thank you very much for your time. I know you got to take care of the most important thing, that's the patience that you've got. But encourage folks to stay ahead of the curve, stay healthy. What message would you have for the drivers out there?
Yes, I believe that mental health is extremely important for your cardiac health. And so if you are experiencing depression, you're sad, or you experience anxiety, PTSD, any of these, you do need to talk to your provider, your physician, your primary care doctor, and get the help you need, especially if you have symptoms, heart disease, like, chest pain. Do not ignore those. 80% of heart disease is preventable if you seek that help on time. So I encourage everybody to take care of your mental health and your cardiac health.
All right, very good. One more time on the website, Doctor. Where can folks find you?
You can find me at www.drfahmifarah.
And again, that's Dr. Fahmi Farah on the line with us.